What if your body is being destroyed from the inside out by the vitamins you trust the most? Currently, more than 87% of older adults use supplements on a daily basis. At least 4 of those vitamins, however, have been connected to heart failure, organ stress, nerve damage, and brain atrophy, according to startling new findings. 1. A popular B vitamin caused brain atrophy in older persons by more than 500%, according to a neurology study. One well-known antioxidant raised death risk by 17%, according to another extensive research published in JAMA. Millions of people still take it every morning, nevertheless. Why? Thus, nobody is being honest with them. The vitamin that 99% of seniors take to be healthy may be deteriorating their bones, impairing their memory, or increasing their blood pressure on a daily basis. Additionally, the most dangerous vitamin we disclose in this video may raise your risk of stroke by an alarming 86%. In the following video, we will reveal the 4. According to actual peer-reviewed research, there are 4 vitamins that could change your health and some that you should avoid. And believe me when I say that vitamin A could literally preserve your freedom. Let me ask you 2 important questions before we get started. Which daily dietary supplement do you take? Depend on most? And have you ever wondered if it might be more detrimental than beneficial? Leave your responses in the comments section. Every single one is being read, and we're responding with tailored advice and suggestions specifically for you. So let's begin by discussing the 4 harmful vitamins. Vitamin A is the 4th vitamin. Vitamin A supports the immune system and is necessary for vision. Here's the issue though. The majority of elderly people do not acquire it from natural foods like sweet potatoes or liver. They are using retinol palmitate, which is its synthetic version. Many multivitamins and fortified meals contain this form. It seems secure, but it isn't. This synthetic form accumulates in the liver and adipose tissue when taken in excess, which is typical for those over 60 who take several supplements. According to a research in the New England Journal of Medicine, taking large amounts of synthetic vitamin A raises the risk of hip fractures by 86% among senior citizens, which is alarming because hip fractures in this age group are linked to a 30% rise in death within the first year. The cause is excessive vitamin A, which accelerates bone resorption, the breakdown of old bone more quickly than new bone formation. It continues. In addition, too much vitamin A can lead to nausea, thinning, dry skin, blurred vision, and even hair loss. All of these symptoms are frequently mistaken for aging. The worst thing is that early damage detection is difficult. Silently, it accumulates. You're probably consuming significantly more cod liver oil than the acceptable upper limit of 3,000 micrograms per day for adults if you're taking a multivitamin. Unbeknownst to them, many elderly pass this threshold. Look for retinol palmitate on the label of any synthetic vitamin A you're taking. Retinol acetate. The wisest move. You can't overdo it since beta-carotene, a form of vitamin A that your body converts as needed, is found in food-based sources including kale, spinach, and carrots. Or use a beta-carotene-containing multivitamin instead, rather than the artificial shape. Over time, that one adjustment might significantly reduce your chance of fractures and help shield your joints, skin, and liver. Vitamin number 3. Vitamin B6 is number 3. It is well known that vitamin B6 plays a part in nerve function and red blood cell synthesis, which is why it's frequently promoted as being necessary for energy and brain health. However, the majority of those over 60 never hear this. Vitamin B6 might have the exact opposite effect from what it is supposed to, particularly in its artificial form, known as excessive amounts of pyridoxine hydrochloride can harm your nervous system over time rather than shield it. More than 200 senior citizens who took B6 pills every day for 2 years were monitored in a thorough study that was published in Neurology. Individuals who took more over 100 milligrams daily, a quantity still discovered. Many high-potency B-complex vitamins started to cause symptoms like burning pain in the legs, difficulty walking, and numbness in the hands and feet. These were not signs of arthritis or aging. They were for nerve poisoning, a recognized adverse consequence of too much B6. Your body just need about 1. After age 60, take 7 milligrams of vitamin B6 daily. However, many seniors consume more than 50 times that amount without realizing it, particularly if they take multivitamins, B-complex, and fortified energy beverages or bars. The risk is that B6 is a water-soluble vitamin, which may seem innocuous because excess is meant to be eliminated by urine. B6 accumulates in nerve tissue, however, in contrast to others. Reversing the harm, if it can be done at all, may take months or even years. This could be the silent culprit if you've been experiencing scorching feet, tingling hands, or inexplicable balance problems when taking a B-complex supplement. Unless your doctor specifically prescribes it, move to food-based sources and stay away from labels listing pyridoxine hydrochloride at levels more than 10 milligrams. Additionally, if you do require a supplement, make sure to keep within the safe level and seek out the bioactive version, pyridoxal 5-phosphate. This small adjustment could assist your vitamin number 2 extremities regain normal circulation and sensation while also protecting your nerves. Iron supplements come in second. One of the most harmful myths in contemporary nutrition is the use of iron supplements for elderly people. In fact, your body needs less iron after the age of 60. He encouraged a lot of individuals to keep taking supplements because, on out-of-date guidance, iron overload, a condition that significantly raises the risk of disease and speeds up aging, is made possible by this. Seniors with high iron storage scored a 2 on the Framingham Heart Study. The risk of heart disease is 4 times higher. Iron serves as an oxidation catalyst ultimately leading to the internal rusting of your cells. Seniors continuously collect iron, and supplements can quickly push levels into the danger zone, in contrast to younger adults who lose iron due to growth or menstruation. Iron overload mostly affects your liver, resulting in hemochromatosis. Fatigue, joint discomfort, and skin discoloration result from this, and these symptoms are frequently misunderstood as typical aging. According to research published in the European Journal of Endocrinology, iron overload also affects the pancreas and raises the risk of diabetes by 80%. Because iron excess is so sneaky, it's especially hazardous. Most individuals never associate iron supplements with symptoms like mood swings, joint pain from arthritis, and chronic weariness because they appear so gradually. It's possible that organ damage will already be irreparable by the time severe symptoms manifest, unless you have an iron diagnosis. If blood tests reveal deficient anemia, stop taking iron supplements completely after the age of 60. Lean meats, legumes, and fortified cereals are good food sources for iron if you need it. To improve absorption naturally, combine foods high in iron with foods high in vitamin C, such as citrus fruits. Having coffee or tea with meals inhibits up to 60% of the absorption of iron, which may aid in avoiding excessive accumulation. Get your vitamin number 1 ferritin levels checked right away if you're using iron supplements without a doctor's supervision. First, calcium. Supplements. The supplement business doesn't want you to know this shocking fact. Millions of seniors regularly take high-dose calcium pills for bone health, but it's possible that they're doing more harm than good. A meta-analysis was published in the British Medical Journal. According to 15 trials with 80,000 participants, taking calcium supplements raised the risk of having a heart attack by 31%. The simplicity of the system is unnerving. Blood calcium levels abruptly rise when you take a calcium supplement. Your bones don't receive this surge as planned. Rather, it hardens your blood vessels by depositing in your arteries and speeding up atherosclerosis. Supplements designed to strengthen bones actually impair your cardiovascular system. This phenomenon is known as the calcium paradox. The Women's Health Program. A 7-year study that tracked 36,000 women found that calcium supplementation did not even reduce fractures as claimed. Even worse, they raised the risk of stroke by 20% and kidney stones by 17%. These results have compelled physicians to reevaluate calcium supplementation recommendations for Seniors. The maximum amount of calcium your body can absorb at once is 500 milligrams. However, a lot of supplements include doses of 1,000 milligrams or more. Like microscopic concrete, this extra calcium travels throughout your bloodstream and settles in soft tissues, where it leads to inflammation and malfunction. Over time, stone development and decreased kidney function result from the kidney's inability to filter this overabundance. The answer is to consume calcium through food throughout the day rather than completely ignoring it. Yogurt has 415 milligrams per cup. A glass of milk enhances 300 milligrams, of which 268 milligrams come from a plate of collard greens. Proper absorption, without hazardous spikes, is made possible by this consistent natural intake. Never take more than 1,000 milligrams of supplements per day, and if you must, take no more than 500 milligrams with meals. 4 optimal essential vitamins you should take consumption. Calcium should always be combined with magnesium and vitamin D. It's time to change the course of events after witnessing the 4 most harmful vitamins subtly harming your health. These following 4 vitamins have been scientifically shown to be safe, help prolong your life, improve cognition, and regain vigor. Vitamin number 4, magnesium, is number 4. One mineral that subtly affects almost every bodily function, yet is absent from practically every senior's daily routine is magnesium. In particular, we are discussing highly absorbable forms, like as magnesium malate or magnesium glycinate. Although magnesium is not a very noticeable nutrient, it is essential for more than 300 enzyme systems that control everything from blood sugar regulation and heart rhythm to muscle contraction and nerve transmission. Nevertheless, more than 70% of adults over 60 are deficient without even being aware of it. According to a critical study that was published in Magnesium Research, seniors who consumed the least amount of magnesium over a 5-year period were 34% more likely to develop type 2 diabetes, 22% more likely to hypertension, and noticeably worse quality sleep. 500 milligrams of magnesium glycinate supplements have been shown in another study published in the Journal of Clinical Sleep Medicine to improve the onset, quality, and duration of sleep in persons over 60. They also lessen the overnight cortisol surges that induce anxiety and early waking. Magnesium functions similarly to an orchestra director. It regulates your heartbeat's rhythm, your muscles' relaxation, and your neurons' steady firing. When levels are low, the heart flutters erratically, muscles cramp, sleep becomes short, and stress seems enlarged. Your body cannot even use the D3 you're taking if you don't have enough magnesium, because it's also necessary to activate vitamin D. Because magnesium oxide is inexpensive, a lot of people try it, but it's poorly absorbed and frequently results in diarrhea. Instead, you're looking for magnesium glycinate, which is attached to magnesium malate, which helps with muscle energy and discomfort, particularly in those with fibromyalgia or chronic fatigue, or the amino acid glycine, which also promotes tranquility and sleep. Magnesium may be the answer if you're experiencing anxiety, insomnia, heart palpitations, muscle twitching, or sugar cravings. Root solution. Take 200 to 400 milligrams after dinner each night to begin. When taken with food and away from calcium supplements, it functions at its optimum. Additionally, always select a high-quality chelated form rather than the inexpensive carbonate or oxide varieties, which only cause stomach distress. Restoring magnesium levels can eventually make you feel as though your nervous system has been rebooted. You might move more easily, think more clearly, and sleep deeper. This is due to the fact that your body has now acquired vitamin number 3. Been pleading in private. Vitamin K2 comes in third. You may be lacking vitamin K2 if you have ever taken calcium for strong bones or vitamin D for immunity, and yet experienced calcified arteries, stiff joints, or low energy. Not just any sort, either. Mequinone 7, the most bioavailable and long-lasting version, is what we are discussing. Vitamin K1 aids in blood coagulation. However, vitamin K2 performs an entirely different function. It provides calcium with guidance. When there is insufficient calcium, it accumulates in the incorrect, where your bones remain fragile, such as your arteries. 244 postmenopausal women who took vitamin K2 daily for 3 years were the subjects of a groundbreaking study in thrombosis and hemoasis. As a result, compared to individuals who did not take it, bone loss was reduced by 50%. Even more startling, though, is what it did to the heart. Those with the highest K2 intake had a 52% reduced chance of arterial calcification and a 57% lower risk of dying from heart disease, according to another study from the Rotterdam Heart Study, which tracked over 4,800 adults 55 and older for 10 years. These figures are significant. They have the power to alter lives. What's going on inside your body is shown here. Your body absorbs more calcium into the blood when you take vitamin D or eat calcium. However, in the absence of vitamin K2, that calcium may not always reach your bones. Alternatively, it may accumulate in soft tissues, such as your kidneys, joints, and arteries. This increases your risk of stroke, hardens your arteries, and boosts blood pressure over time. 2 proteins that conduct calcium are activated by K2. Matrix GLA protein and osteocolin, away from arteries and into bones. These proteins remain dormant in the absence of adequate K2, and your body ends up accumulating calcium in the wrong places. Except for natto, a fermented soybean dish that is famous in Japan, few foods contain K2. The majority of diets in the West are nearly entirely lacking. Because of this, a supplement is required, particularly after the age of 60. When bone density starts to quickly decrease and calcium regulation becomes more delicate. Choose a supplement that states 7 Malawian kwaches on the label for optimal absorption. It is best taken with a fatty meal and in conjunction with D3. In contrast to other variants, 7 Malawian kwaches remains active in your body extra time to use the blood for up to 72 hours. If you're already taking calcium or vitamin D, you risk vitamin number 2 reinforcing the wrong walls if you don't add K2. It's like building a house without a blueprint. Second, fatty acids with omega-3 content. Your brain's building blocks are omega-3 fatty acids, particularly EPA and DHA, which also act as natural fire extinguishers for the chronic inflammation that causes aging. However, the majority of elderly people are gravely lacking. An innovative study that was printed in the American Journal of Clinical Nutrition discovered that those over 65 who had the highest blood levels of EPA and DHA lived an average of 4 years longer and had a 35% lower risk of heart disease and a 20% lower risk of Alzheimer's. Longer than those with low levels by 7 years. That is the distinction between decline and independence, between both being bedridden and active. The slow-burning cause of heart disease, arthritis, type 2 diabetes, and even some types of cancer, systemic inflammation, is lessened by EPA. On the other hand, your brain utilizes DHA to keep its membranes fluid so that neurons can communicate appropriately. Seniors who have little DHA experience memory loss, sadness, and cognitive decline more quickly. Here's the catch, though. Walnuts and flax seeds don't provide significant levels of EPA or DHA. Those only include ALA, which your body needs to convert less than 5% of the time into EPA and DHA. This implies that you must obtain it either directly from fatty fish, such as mackerel, sardines, or salmon, or from a premium fish oil or algal oil supplement. If you've been experiencing joint stiffness, forgetfulness, emotional flatness, or if your blood pressure or triglycerides are excessive, you might be deficient in omega-3 fatty acids. The answer is straightforward but effective. Consume 1,000 to 2,000 milligrams of mixed EPA and DHA daily, preferably with a fat-based diet. Seek for companies that are purified by molecular distillation and examined for oxidation and mercury. Choose an algae-based DHA and EPA combination that corresponds to those levels if you're a plant-based diet. The effects may be noticeable after a few months. Blood pressure stabilizes, mood improves, cognition improves, and inflammation subsides. And occasionally, even eye dryness gets better. Omega-3 fatty acids not only promote health, but also repair its base. Vitamin number 1 is the one vitamin that seniors who want to regain their health, vitality, and clarity simply cannot afford. Omit. First, vitamin D3. The most important supplement for anyone over 60 is vitamin D3. More than 1,000 genes in your body are influenced by this hormone-like vitamin, which has an impact on everything from mood control to immunological function. However, 75% of elderly people are deficient, which increases the risk of disease in all bodily systems and accelerates aging. According to study by the Vitamin D Council, optimal levels of 40 to 60 nanog/ml lower all cause mortality by 31%. The risk of cancer decreases by 35%, depression by 45%, and autoimmune illness by 40%. These aren't small enhancements. Rather, they are significant distinctions that explain why some seniors flourish while others experience a sharp decline. After age 60, your skin's capacity to produce vitamin D from sunshine drops by 75%. In combination, this leads to a perfect storm of deficiencies when combined with decreased outdoor activity and sunscreen use. Due to the fact that aging skin simply cannot produce enough vitamin D, even in sunny locations, cedars frequently have dangerously low amounts. Personalized supplementation based on blood levels is necessary. To achieve optimal levels, the majority of seniors require 4,000 to 6,000 international units per day, which is far more than the antiquated RDA of 800 international units. The bioavailability of vitamin D3 is 87% higher than that of vitamin D2. Because vitamin D is fat-soluble, take it with your fattest meal. Fat in the diet for absorption. Every facet of health is impacted by the shift from ideal vitamin D levels. A 19% increase in muscle strength considerably lowers the chance of falls. Supplemental studies have shown a 42% decrease in respiratory infections, indicating a remarkable strengthening of immune function. As fracture risk falls, bone density rises. A 53% decreased incidence of dementia is linked to adequate D3 levels, which also boost cognitive performance. Check your levels every 3 months at first, and then every 6 months after they are optimal. To get the most out of D3, combine it with K2 and magnesium. Security. 99% of seniors will never hear from their doctor, as you have just discovered. The 4 potent vitamins that may repair your body from the inside out, as well as the hidden risks that are present in your everyday pills. We'd like to hear from you now. Have any of the bad ones been in your system? Which of the nice ones will you begin today? Please leave your thoughts and experiences in the comments section below. We enjoy listening to them. Thank you for viewing.